am Yohannes Kabede from Jimma University Health Paper and Society Department, Ethiopia. I'm a member of Health Campaign Effectiveness Project hosted by Jimma University, entitled Evaluating the Effectiveness, Acceptability, Visibility of Co-Delivery of 2MDAs and 3 Complementary Health Intervention, which is an implementation research in Ethiopia. And now I'm going to provide you a brief description of the virtual poster, which has 5 sessions, some background, expected outcomes, mainly emphasized on campaign delivery strategies based on experience and the proposed strategies, and few insights about campaign staffs and training and community mobilization. The main aspect of the poster is campaign delivery strategies. And to begin from background, in Ethiopia, there is limited coordination, efficiency, and co-delivery of health campaigns, even within a specific program, that is NTDs and 5 mass drug administration campaigns, as Ministry of Health reported by 2020. So while integrations are potential solutions of health campaign effectiveness, evidence are still lacking in resource-limited settings such as Ethiopia regarding how effective, acceptable, and feasible such proposed solutions integrations are. So the current project hosted by Jimma University expected us to measure campaign effectiveness, that is the extent to which this co-delivery of 2MDAs, meaning Onchocerciasis and STH, together with complementary health interventions such as water, sanitation and hygiene, COVID-19, and the SBCC aspect of referring unvaccinated children, unvaccinated and children who are dropped out of the immunization services to the nearest health facilities. So the second expected outcome is how effective is the implementation strategies in terms of visibility, acceptability, adaptability, and sustainability of the strategies we are proposing to integrate these 2MDAs plus the SPC aspect of the 3 complementary strategies. And we want to look the hindrances and opportunities. And finally, we expect out of this project to compile best practices which can influence and change campaign practices and policy guidelines. So in this poster, we are mainly interested to present campaign delivery strategies, and we are still on the formative stage and assessment stage and co-design stage in this project. In fact, however, we want to mix the experiences and proposed strategies. So I'm going to present 3 things about campaign delivery strategies. One is the co-creation, the second is co-delivery system, and the third is delivery strategies. The co-creation is aimed to design evidence-based and participatory co-delivery of 2MDAs and 3 complementary strategies. We have 2 main activities to co-design this program. The first is understanding the past experiences pertaining to MDAs. That is, we have already assessed challenges, opportunities, successes, and community and stakeholders engagement. And we are soon going to plan micro-planning of the co-delivery, and we are discussing with key stakeholders, sectors to engage in this program, multi-level health systems at national, regional, zonal and district level, including PHCU and frontline health workers, to meet together, to have role of different stakeholders specified, and system of co-delivery is established. The second element of co-delivery strategy is the co-delivery system itself. This is how this co-delivery system and operational procedures are organized. So this also has two aspects: operational procedures and the co-delivery team and responsibilities. The operational procedure of the co-delivery includes mobilization of attendants and eligible population at different levels, at pre-campaign, intra-campaign levels, and on-site education and awareness creation for the need to have two campaigns together, and why these drugs are given together with the SBCC aspect of COVID-19, hygiene, and the need to refer unvaccinated one. The third is registration, on-site registration of eligible population, drug administration, and side effect monitoring and management. These are operational procedures at the campaign. In fact, this is the procedure we want to propose, and the co-delivery team to carry out this operational procedure includes basically community health workers, whose responsibility mainly is to engage on education, drug administration, side effect management, and referral. And community drug distributors and local leaders will be part of the team and support team, and they engage on registration, eligibility checkups, health measurements, and generally provide support to community health workers. Coming to the delivery setting, strategies, and stakeholder engagement, two things I want to present is as part of experience, Onchocerciasis has been given at Gary level and through house-to-house visit based on convenience of CDD. It was entirely given to the CDDs to distribute this drug. And now we want to establish a team of health workers, and these CDDs as support team to this at Gary level, or bringing two Garys together. Gary means the collection of 30 households at once. So it is it operates at Ganda level. There are about 30 to 40 Garys at Ganda level. Ganda means the minimum administrative governance administration body. So for a stage has been mainly dominantly given at school and throughout of school, through home visit and through Gary and at health boards also. And we want to bring together these two, and we are planning to give this combination of co-delivery of onco and stage at Gary level now. And with regard to stakeholders engagement, schools, religious settings and leaders, and community volunteers, including the CDDs and community elected supervisors, are going to engage in this household, in this campaign. With regard to campaign staffing, as I've said earlier, community health workers at PHCU level, one person from health center, and two health extension workers at health post level will be the main community health workers located in co-delivery team at one delivery point. So the supervisory team are engaged from primary care unit and district health offices, and voluntary staffs are also there. The CDDs, community supervisors are also there. So the trainings of these staffs are given at zonal level, district, and PHCU levels also. With regard to community mobilization strategies, in support of this campaign delivery strategies, there will be multiple exposure to this community communication about these 2 campaigns and 3 complementary intervention. That is at registration, household registration, during household registration, pre and intra campaigns. There are 5 strategies through which this community mobilization is carried out. The first is IEC material. We will develop flip charts, posters, cards, and key messages are also printed on registration books. Trained and oriented community volunteers such as CDDs and thought leaders will also engage on educating the public during pre-campaigns and registration time mainly. Community networks at Ganda levels, meaning at Ganda level there are networks and community organization levels are there. At Zoni level, at Gari, and all levels. Zoni has Ganda has 3 zoni, and Zoni has about 30, at Ganda level there are about 30 to 40 Garis, and per Gari there are about 5 to 6 Olla networks are there. So these leaders will reach out to householders and eligible population during pre-campaign. And school-centered directors, school directors, teachers, and students will reach out to the rest of students and family. Otherwise, the frontline health workers are highly recruited to educate about side effects, especially during on-site campaign, the actual campaign delivery time and sites. So this is the main topic I want to present, and thank you very much.